Hello and welcome back. I'm Ted Gottlieb, Certified Senior Advisor, Seniors Real Estate Specialist, and founder of the Senior Learning Institute. At the Senior Learning Institute, it's all about providing free education and resources to older adults and their advocates. This Senior Learning Institute educational moment features occupational therapist Jenny Williams. She's back. In this second of 5 short episodes, we're discussing what comes next after being told by the rehab facility, the hospital, or the skilled nursing facility that it's time for you to leave. Jenny, let's break down the discharge process. Let's say that I had a stroke, had knee replacement surgery, had hip surgery, you name it. How does the facility, the place where I'm staying and recuperating or healing, determine that it's time to cut me loose?
There are a couple of different factors that can play into that. Number one, mostly your insurance. So different insurance plans have different criteria, but typically the goal for going home is you need to be able to stand up on your own. They like you to be able to walk approximately 100, 150 feet and to be able to take care of most of your self-care needs or have caregivers in place to assist you.
What if, I just decided I don't want to leave. I'm not ready to go. I don't have the confidence, don't have the energy.
That may or may not be, unfortunately, may or may not be your decision. Insurance has pretty strict guidelines as to what they're willing to cover. There is an appeal process if you feel strongly that you're not able to go home.
And would that be something that I would need to go through my primary or my physician, whoever's in charge, to start that process?
It can be started, well, if you're in a skilled nursing facility, they have patient care advocates who will be able to help you with that.
When I'm discharged, am I almost always being sent home?
No, there are several options you have when you're being discharged from a hospital or skilled nursing facility. You may be able to be discharged to an assisted living facility for a couple weeks while you regain your strength. Some people discharge to home and some people will discharge to a family member's house.
All right, so I've been rehabbing for a while and I'm starting to hear rumblings that they're going to discharge me. Is that a quick process? Am I given a whole bunch of notice or am I pretty much having to scramble?
They should be starting the discharge process with you day one. So wherever you're at for rehab should be giving you the understanding of how this process is going to work with the discharge date in mind. There should be regular discharge planning meetings so that you and your family are aware of when is expected that you'll be discharging home.
Okay. So I'm under the impression that when I am discharged to return, let's just say to my home, an occupational therapist will visit me there to check the place out. How does that work?
Yeah, usually when a person is discharged home, they go with home health. So home health is a skilled service provided by your Medicare that covers OT, PT, a nurse, and a bath aide. So usually an occupational therapist will be one of the first persons to come to your house and they will walk through your whole home and make any recommendations for equipment or any modifications that may make it safer for you to be at home.
Right. So who pays for these services and changes if I have to do things to my house?
Medicare or your insurance pays for the home health service. Any equipment or modifications is variable depending on your insurance. Medicare does not pay for bathroom equipment such as shower chairs or commodes or raised toilet seats, but they will provide a walker or a cane.
So Jenny, you had mentioned a couple different times during our conversation that oftentimes the insurance that we have will dictate what it is, the level of care that we may be getting, or the period of time that we're going to be able to get it. And my question along those same lines is the insurance carrier going to also determine what services are paid for through their policies and what might be out of pocket to me?
Yes. And whenever you start up with home health or you're in rehab, you will be asked to sign consent forms that lay out exactly what your insurance pays for and if there will be any patient responsibility involved. And sometimes an illness and injury comes along unexpectedly, so it doesn't give you much time to prepare for that. But if you're planning on having a procedure, say a knee replacement or a hip replacement, I would suggest calling your insurance company beforehand and asking for the details of what will be covered by your plan, so you're prepared.
Okay, well, that's fair. Are these services that are typically provided by my insurance carrier, whether it be private insurance or whether it be through Medicare, is that normally enough, or am I going to need additional care that once again might also be out of pocket?
Typically, and I will say that most insurances follow Medicare's guidelines. So sometimes they're different and they have different stipulations, but most of the time, most insurances follow Medicare standards. So Medicare says that as long as the services are medically necessary and you're making progress, you can continue on with those services. So there are times when maybe you're just kind of stalled out, not making as much progress as the therapist would like, and they may have to discharge you. At that point, you can get additional services, private pay, but most of the time, Medicare will follow you through as long as you're making progress, and
Okay.
those services will be covered.
Right now, I was involved in a case where somebody came home from the hospital after being there for 5 or 6 days. Anesthesia was pretty much out of his system, but he still was not quite, I think where he wanted to be. And it was determined that it would be best to have somebody there overnight, to be there by his bedside, just in case he decided to get up in the middle of the night to try to maybe prevent a fall or something along those lines. That's often known as private duty or custodial care. Custodial care is something that would be extra and would be out of pocket. Is that right?
Yeah, that's correct. Unfortunately, Medicare's line of thinking is that if you are at the point where you're needing 24-hour care, home is not the place for you. So at that point, Medicare is not going to pay for that service in the home because they would recommend a higher level of care. So if that's something that you just want to be at home, you're welcome to pay out of pocket for those services.
Makes sense. Okay. I think, Jenny, this is a great place to pause and digest. In episode 3 with Jenny, we're going to address how occupational therapists determine what services will benefit their patient. This is often known as the evaluation. Jenny, if someone's watching this for the first time and wants the best way for them to track you down and get a hold of you if they want to inquire about your services or just learn more about what you do.
Sure, you can reach me. My office number is area code 314-742-0330. And you can visit my website at iots.health.
IOTS.health. What's the IOTS stand for?
Innovative Occupational Therapy Solutions.
Ah, that's your name, your business name?
Yep.
Awesome. Very cool logo as well, by the way. All
Thank you.
right. So IOTS.health or 314-742-0330. Want to thank you all again for listening to the Senior Learning Institute educational moment. At the Senior Learning Institute, we strive to provide straightforward and unbiased information, the information you need to make smart decisions the first time. You'll hear this time and time again, but our goal is to connect older adults and their advocates to the resources they need. Things like aging in place, selling the home in any condition, estate and financial planning, in-home care, estate sales, clean out services, you name it. Anywhere in the US, we got a call yesterday from someone in Atlanta, Georgia, a suburb about 35 miles north, looking for help, for advocacy help, and for care management. So we're really helping folks all over the place. To learn more, please visit us at theseniorlearninginstitute.com. Until next time, I'm Ted Gottlieb, founder of the Senior Learning Institute, certified senior advisor, and seniors real estate specialist.